Hello, my name's Steve McFadyen and I'm the Senior Policy Officer at Alzheimer Society, and I'll be talking today about our partnership work with Sport England and supporting people affected by dementia to lead more active lives. So several systematic reviews have identified that exercise has the potential to improve the physical and psychological well-being of people living with dementia. Some of the recent studies have shown that exercise may improve memory and slow down mental decline. Other empirical studies have shown that people with dementia benefit from exercise interventions, with participants gaining improvements in strength, physical function, mood, and well-being. But despite this, we know that people living with a long-term health condition are twice as likely to be inactive, and this figure may be even higher for people living with dementia. The current data is limited, but we know from one of our funded research projects that almost 80% of people living with dementia included in this study could be classed as inactive, and almost 40% have dropped activity since receiving their diagnosis, and this is even higher for those living alone. Since 2018, we've been partnered with Sport England, and during the first couple of years of our partnership, we focused on supporting the sport and physical activity sector to be more dementia friendly. And we launched the Dementia Friendly Sport and Physical Activity Guide in February 2019. So this project helped us start to build the understanding of the complex relationship and barriers facing people affected by dementia when it comes to taking part in physical activity at different stages of their life. A range of factors can contribute to reasons why a person living with dementia might have different activity levels. We've looked at the data that's explored different barriers and motivators to physical activity for people living with dementia. So some of the barriers related specifically to people with dementia are presented here, and they include things like physical limitations due to their dementia, a lack of social support, so including discouragement from a loved one due to safety concerns, or carers may also restrict opportunities by typically taking on more domestic roles so that people become less active at home, and also a lack of understanding and a lack of opportunities. And many of these barriers have been compounded by COVID and lockdown restrictions limiting opportunities for people to kind of be outside, but also with restrictions now easing, people are also wanting to avoid busy places and areas. But despite the barriers, there have also been many motivators and facilitators that support people living with dementia to be active. And within the literature, we've seen that people living with dementia kind of see the benefits in terms of physical, mental, and social benefits of physical activity. Social support is a big one, and having the opportunity to do activities with someone is a real positive. And also interestingly, time has come up as a facilitator. And one study looking at physical activity for people with dementia in care homes, they found that physical activity was a good way to pass the time. So our partnership now with Sport England has evolved. And from January 2021, our programme sat within Alzheimer Society's policy team so that we can ensure this becomes part of our wider policy strategy. So our new programme of work focuses on three main areas. So research, so we've commissioned an evidence review, and the review will consider two questions. Firstly, around the prevalence of physical activity and the experiences of people living with dementia when it comes to being active. And the second, we'll look at the evidence of the potential benefits and harms of physical activity for people living with dementia. And then alongside this, we're going to be accompanying that with insight gathering directly from people affected by dementia so that we can understand their barriers and motivators when it comes to their own lived experience. The next piece of work around innovation. So the next piece of work will bring all of that insight together. We will work with our innovation team and our research part of the organisation to define a very specific challenge that stops people living with dementia to being more active. And what we'll do, we'll work with them using a behaviour change approach. And this will guide our intervention development so that we can find an evidence-based solution to that specific challenge. And then this intervention will be tested, developed, and fully evaluated to hopefully act as a solution to get more people active. And then influencing, so our other strand of work is around influencing, so internally to ensure that physical activity is high on the agenda for our charity, but also developing our external policy position, so how we can join up as a whole to make life better for people living with dementia. So we're at the start of a really exciting few years of work that is going to be evidence-led and focused on developing solutions and long-term change for people affected by dementia. Thank you very much for listening. If you have any questions or would like more information about our programme of work, then please do send an email to myself or my colleague, and we'll be happy to help as much as we can. Thank you.